We'll look at another abbreviation in chemical pathology that you are likely to always come across. And this is what is known as a deep vein thrombosis. This is DVT. Deep vein thrombosis. So for DVT, that's deep vein thrombosis. You see how it is. So it's also a serious condition. This is where blood clot forms in a deep vein, usually in the leg. So it causes a lot of pain, makes your legs to swell up, and your leg is warm when you try to feel for it. So there's a blood clot in a deep vein. So symptoms of deep vein thrombosis, to be specific now, your leg is swollen. Often usually affects one leg, the other leg is fine. So there's pain and tenderness. If you touch the leg, it's warm. The skin color is changing, so it's becoming reddish, purplish, darkish. So there's swollen veins, and sometimes there's no symptoms at all, though, which is hard to dictate. So causes and risk factors, it could be that you have sat down for too long, prolonged immobility, injury and surgery, damage to veins, okay, pregnancy and postpartum period. So after pregnancy, you know, hormones, where all those birth control pills, hormone replacement therapy, all of them could actually, affect that. And sometimes some drugs used in treating cancer, heart failure, inflammatory bowel disease, their side effects could cause a DVT for you. Also, lifestyle factors like you smoke, you are obese, or you are dehydrated. Also, genetics. You can inherit some, clotting factor disorders. So, complications, it could lead to pulmonary embolism, where a blood clot here can actually cut and go to the lungs and block the lungs. Okay. Post thrombotic syndrome, where there's long term leg pain and swelling and skin changes, and also bleeding risk. Okay. So, as they are giving you drugs to actually what? Dissolve these blood clots. Those drugs are also against blood clotting in general. So, if you happen to get a wound at that time, you bleed so much. You diagnose deep vein thrombosis through ultrasound, venogram, MRI scans, CT scans, D-dimer blood test. Okay, you also give all those anticoagulants like warfarin, heparin, apixaban, rivaroxaban, okay, and also thrombolytics, and also compression stockings to reduce swelling and also prevent complications.